All right. So I am going to be talking about erectile dysfunction. I'll be doing an overview of that today, basically talking about things that we do in the office specifically, but I'll also be talking about other types of treatment options as well. So just real quickly, I am a board certified clinical nurse specialist. I am practicing at Austin Urology Institute. Some of you may be patients there. Some of you may just be some people who got word of mouth about this webinar. Either way, welcome to the webinar this evening. My focus is on men's health and wellness. I am super passionate about all things like hormones and optimization, overall wellness and quality of life. It's kind of my jam. So super excited tonight to be going over some of these things. And for those of you who stick around till the end, there will be some live Q&A. So if you have any questions that I have not answered, then I will be answering it at the end. Also, there will be a bonus at the end if you do stick around for some of you who might be interested in doing some of the treatment options we offer here at the office. So ready or not, here we go. So quick overview. Most of you already know a basic definition of what erectile dysfunction is. The American Urological Association defines erectile dysfunction as the persistent or recurrent inability to achieve and maintain a penile erection sufficient for sexual performance. There is, even to go even further or more specific, they do say that it is more than 6 months of having this as an issue. So, if it hasn't been 6 months, it's only been 3 months that you've been suffering from this. That does not mean that we would not have conversations with you and discuss potential treatment options, but that's just kind of some of the more specific criteria for erectile dysfunction. Now, some of you, unless you're having some locker room chats about your issues, you just, so that you're aware, you're not alone. This erectile dysfunction affects millions and millions of people. In fact, there was a Johns Hopkins article that revealed that at the end of 2025, they were predicting over 300 million people worldwide or not people, but men would be suffering from this issue. So very, very common. The last point here is that it does increase with age. We see it more commonly in older gentlemen, not always, but in general, we do. This is a really, really good slide. I like it just because it talks about the outliers. This was a study that was done and published in the Journal of Urology. And basically what they did is they explored the prevalence of ED in younger men. So as I stated in the previous slide, that it's common in older men. However, sort of anecdotally, and even what I've been seeing in the literature, younger men have been reporting issues of erectile dysfunction. So at some point, somebody was like, hey, let's figure out why this is happening. So they did a cross-sectional survey. About 2,600 sexually active men between the ages of 18 and 31 were surveyed. They included different things like demographics, mental health status, metabolic factors, tied it all in. And the data told us that 11.3% of those men had mild erectile dysfunction. That's a pretty significant number. 2.9% had moderate to severe ED. And interestingly, of those people, 65% of them had lower odds of ED if they were married or partnered. So if you remember, this is a younger age gap, 18 to 31. So kind of makes sense a little bit. But what they found from all of that is that ED in sexually active adults is strongly associated with the relationship status and mental health. So basically, single men with anxiety or depression oftentimes had symptoms of erectile dysfunction. So super, super interesting study. Obviously, this study was limited in many ways, including racial and socioeconomic diversity. So that's just something to think about. But in general, sort of an interesting take on what we think of when we think about erectile dysfunction. So what are symptoms of erectile dysfunction? So we've kind of hammered it a little bit with the definition, but in general, if you can't get the erection and you can't keep the erection, that's pretty much an issue there. But there are other sort of pieces to that as well. So premature ejaculation, often in a younger population of people, but can also be in other age groups, is is the act of ejaculation prematurely, as it states. And so in those cases, premature ejaculation, patients who have premature ejaculation don't always have the inability to achieve or keep an erection. But if you have those, if you have that as an issue, you can also have premature ejaculation, if that kind of makes sense. So not always will you see this, but it can be a factor. And we'll, as we talk about some of the causes of why erectile dysfunction occurs, we'll talk about how premature ejaculation kind of plays into that. Reduced sex drive. If you're not feeling it, you're not in the mood, probably not going to have sex. And then low testosterone levels as well. We think about hormones as being a big part of why different symptoms can occur. And in men with ED issues, we've got to remember testosterone as being a part of that. So causes of erectile dysfunction. So oftentimes this is a very popular question that we get in the office. Why do I have erectile dysfunction? What's causing my erectile dysfunction? As you can see on this slide, there are tons and tons of things that cause erectile dysfunction. But the most common of things are here on this slide. So cardiovascular disease, hypertension, diabetes, those are all part of the chronic illnesses that people have. And not just having them, but them being sort of non-compliant with treatment options and things like that. So what I mean is, like, someone with diabetes may not necessarily have erectile dysfunction, but if you have uncontrolled diabetes where your glucose levels are elevated, it might be an issue of decreased sensitivity, neuropathy, and things of that nature that might affect your ability to get an erection. Same thing with the cardiovascular disease and high blood pressure. If these are uncontrolled, your blood pressure is high, you've got cardiovascular diseases that are worsening and not being managed or treated appropriately, this could lead to the inability for you to get an erection. Stress, a big one. Lots of people, both men and women, have things in life that stress them out. Oftentimes, we don't always consider stress as a reason why sexual intercourse is difficult, but it can be sort of unconsciously as well, right? So, sometimes we've got to appreciate that life can happen, and it can also interfere with our abilities to engage in sexual performance. So stress is definitely a big one on there. Alcohol is another one. So alcohol, engaging in alcohol sometimes can be a reason why someone may not have or be able to get an erection, or even mostly maintain the erection. It could be a social alcohol situation, or even someone who engages or consumes alcohol on a daily basis. So just considering that as a piece. Medication is a big one. Some high blood pressure medications can cause erectile dysfunction. Antidepressants can cause ED. Finasteride is a big one. So finasteride is actually a medication used for both hair loss and men with enlarged prostates. This can, if there's something called finasteride syndrome, that could be part of why you're having erectile dysfunction. So considering medication as something is very important as well. Cigarette smoking, aging, as we discussed earlier. Nerve or spinal damage is a big one, right? So if you've been in a motor vehicle accident or some sort of injury to your back, that could affect, especially depending on where on the spine you were affected, that can definitely impact your ability to get an erection. And then, as we mentioned before, low testosterone levels as well. One thing that's not on here that could be a reason for erectile dysfunction is, and something that we treat, is for post-prostatectomy. So that's when we remove the prostate if you've had prostate cancer. In our office, we have a pretty good pre and post rehab of after you've had your prostate removed to help with erectile dysfunction, whether that's adding medications, getting you to do pelvic floor therapy, or penis pumps or Trimex injections, things of that nature. But definitely important to keep in mind, because when they do remove the prostate, even in surgeries like our doctor does, which is nerve sparing surgery, there's still, the prostate is so close to those nerves that innervate for an erection. And so it can definitely be affected post-surgery, either temporarily and even sometimes permanently. So, if you have experienced this, it's not uncommon. So how is erectile dysfunction diagnosed? Well, you come into the clinic, we review your lifestyle, some risk factors, all those things we talked about on the previous page. We discuss symptoms. How long have you had this issue? Sometimes that's a very, very important question, right? Did it just start, as we mentioned at the beginning of the presentation, 3 months ago, 6 months ago, or has it been years? And depending on how long it's been, that's really going to depend on how good or effective your treatment can be, and also which type of treatment is going to be best for you. Medication review, looking over your medications. As I stated on the previous slide, it's important for us to make sure that there's nothing that we're missing from a medication standpoint. If there's medications that you have to be on, can we maybe change it to a different kind of medication that may not be as prone to erectile dysfunction? So talking to your other providers about maybe changing out the medication. And then physical examination. So depending on what symptoms you're presenting with, we're going to talk to you about possibly putting our hands on you, getting a good genital exam. If you're seeing a curvature or pain with an erection, which we'll talk about later on in the presentation, we need to palpate and feel for any kind of plaque formation that might be present in the penile area. So that could be part of a physical exam. And then, assessing for signs of hormonal imbalance or vascular issues that might be obviously present on the penis as well. So laboratory tests. So I told you earlier that it's super important to screen for any sort of chronic or acute issues that you might be having. We want to make sure that your diabetes is under control if you have it, or if you don't know that you have it. So screening for it, looking at your lipid profile to make sure that you're not at risk for heart disease or any other kind of major cardiovascular issues. And then looking at your testosterone levels to rule out low testosterone as being a cause to why you might be having ED. So how does an erection occur? So we kind of talked about, what it is, what causes it. Now, to get a little bit more detailed, how does it actually happen from a pathophysiological standpoint? An erection is an emotional event that begins in the brain. So that's why we talk about how important it is to be in the mood. So if you have low libido, it's going to be hard for you to have that emotional event in the brain happening. But this physical or mental stimulation causes nerves in the brain to send a chemical message to the nerves in the penis to tell the penile blood vessels to relax, and so that the blood can flow freely into the penis. So once it's in the penis, then you have high pressure traps the blood in there, in what we call the corpus cavernosum. And this causes the penis to expand and then sustain an erection. And then reversely, you get the inflow to stop it. You get the opening of those channels and outflow of blood, so that then you lose your erection and you become flaccid. So that's why, being in the mood is oftentimes very important part, or having, a good libido, very important part of making sure you can get an erection. But then also, if there's stress or other psychological issues that are going on, it's going to be sort of messing around with some of these signals that happen in order for you to get an erection. So ED treatment options. So we've talked about what an erection is, what the symptoms are. We've talked about how we get it or what the causes are. So now some people might be asking, okay, I'm not ready to take a pill, or I'm not ready to do an injection or other things like that. Well, as you can see on the left-hand side, we do have some non-pharmaceutical ways to help some with ED options or ED treatment options. So lifestyle modifications, right? That can seem a little bit easy for some people, but it can be a little bit difficult for others. So if you're overweight, losing weight, if you're a drinker or smoker or do drugs, kind of trying to minimize or cessation of that altogether. Exercise is an important one. If you can, increase blood flow with exercise, especially like weightlifting, that's going to be a good lifestyle modification. Diet changes, eating more fresh fruits, whole grains. You want to limit saturated or trans fat in your diet. Flavonoids, which are antioxidants, which are found in many things like berries, types of different berries. And then nitrates. Those are all things that can help with, from like a diet perspective, essentially help increase blood flow. And then as far as supplements are concerned, the more studied evidence-based supplements are going to be things like L-citrulline, L-arginine. Those are ones that we often tell patients to do even while we're doing some of these other treatment options, which we'll discuss later. Zinc is a good one. Vitamin D, ashwagandha, horny goat weed is another one that has some good data on it. So if you're on any of these supplements and maybe wondering if it's, being done in vain, maybe not. Not everybody's going to have the same response, but if you're looking to be more conservative in your approach to erectile dysfunction, those are definitely good ways to go for sure. Counseling or sex therapy is one that not often lots of people want to talk about. But if there's issues in the relationship or issues with yourself that you are battling with, counseling or sex therapy is always a good way to go. And we can refer you to someone for that as well. So always needing to consider that. Pelvic floor therapy. So I talked about it just a bit when I was talking about post-prostatectomy patients. Pelvic floor therapy is a way to help strengthen or loosen the pelvic floor, just depending on what is going on below the belt. We have exercises that we can give you. We also have a pelvic floor therapist who is amazing, that can take the time out with you to go over your symptoms and see if some of the exercise and different therapies that she does from her practice can help you with that as well. Shockwave therapy or PRP, which we'll talk about in later slides, is also an option. On the pharmaceutical side, we've got the go-to sort of PDE5 inhibitors. These medications increase blood flow to the penis. Viagra, Cialis, those are kind of our go-tos in our practice. I'm not seeing any of the providers doing anything much more than these from an oral medication standpoint. These, Viagra is kind of an oldie but goodie, long time medication that does well in lots of people. And then Cialis is a good one. We call that, or used to call it, the weekend drug, because it has a longer shelf life. So you can take it on a Friday and get pretty good results into the weekend. And oftentimes, those are good go-tos, sort of the when we think about where we start in terms of like ED treatment options. We usually start with the oral medications as first line treatments. However, they can cause side effects. Often common side effects of these medications are going to be stuffy nose, headaches, flushing feeling, things that most men don't want to experience before or during sexual activity. So, oftentimes we can kind of mess around with the dosing here and there to see if it works. Cialis is a good one because we can do a low dose Cialis every day to kind of maintain increased blood flow to the penis. And oftentimes that low dose doesn't have as many side effects, or oftentimes no side effects at all at that dose. But also if you're a gentleman who has prostate related issues, there's good data out there that supports Cialis as being helpful for those symptoms as well. So if you have prostate-related issues and then also ED, Cialis 5 milligrams daily is definitely a good way to go. We kind of like that combination in our practice and oftentimes use it because we do see both of those issues in our practice. So penile injections like Trimex we'll talk about later. PT141 is actually a peptide. I won't go too much into this, but in general, PT141 is a peptide that stimulates our melanocortin receptors in our brain that tell us that help with sexual arousal and activity. And so unlike the Viagra and the Cialis, PT141 stimulates from our central nervous system and increases libido, and as a result can also help with erectile dysfunction. In fact, I've had patients in the past who have stopped their Cialis Viagra prescriptions and done just PT141 because they believe it to be amazing and sort of a better overall treatment for them. That peptide does come in nasal spray as well as injectable, and we do offer it in our clinic as a prescription through our compounding pharmacy. So if that's something that you are interested, definitely reach out to us and let us know. Vacuum erection devices, I'll talk about on another slide. And then penile implants is a surgical procedure. We don't do that in our practice, but we can certainly refer you to the great people that do. But again, sort of that's on the list, down on the list of the totem pole after much of these other things have been tried. So we usually don't go to that unless absolutely necessary. So second line therapy options, as I mentioned, the vacuum erection devices and constriction rings you can see here. That gray the device there, I don't know if you'd call it a device, but it's a constriction ring. It's a ring. And that is used to help with maintaining an erection. So you put that inner part of the ring over the down on the shaft of the penis or the base of the penis. And then it's supposed to, after you get the erection, it's supposed to help maintain the erection by constricting down and keeping blood in the penis and prohibiting it from escaping, basically. So that's a constriction ring. Some people love it. Others don't. It can be non-invasive, user-friendly, because it's pretty straightforward on how to put it on. It can be cost-effective, safe when used correctly. Some effectiveness does vary, right? So not everybody's going to get the benefits that somebody else might get. Downsides may cause discomfort or injury, and it can interfere with spontaneity a little bit. So trying to, mess around with it and stuff like that, some people will complain that it's not the greatest when it comes to trying to get their business going. This other photo is a vacuum erection device. So those can be quite detailed. If you look online, there's so many different types. The biggest thing with these is lubrication. So if you're going to use these, just making sure that you use a water-based lubricant to help keep things super moisturized, because you don't want that suction to cause so much discomfort. And we oftentimes will use the vacuum erection devices after the PRP or P-shot treatment, which I'll talk about later, just because we need to help maintain the erection after we've done the P-shot. So we'll often recommend that that you guys get a vacuum erection device for that. Continuing with second line therapies, Trimex is a big one. Trimex has 3 ingredients, most of all just which relax the smooth muscles and helps to either dilate or increase blood flow or prevent blood flow from leaving the penis. And if you don't do well with Trimix, there is an extension of Trimex, Super Trimix, Quad Mix. When you get to Quad Mix, it's just adding another ingredient that helps with nerve signaling, and that can further help give and maintain an erection. Trimex injections do really well. They're very, very effective, as we've seen in clinic and in practice, especially if pills don't work. They're great after prostate surgery or with patients with diabetes with that neuropathy issue. They're fast acting, so they act, usually 5 to 10 minutes is when we start seeing a reaction. These injections are done first time in the clinic. So we do what's called a Trimex trial, and we'll have you come in. We will then administer the injection to the penis, and then we give you some time to see if you get a reaction to it. So if I haven't said it already, it's an injection, but it's self-injected into the penis. And so it works directly to increase the blood flow in the corpus cavernosum, which engorges with blood and then helps you maintain the erection. Now, the bad thing is that you have to inject it yourself. But with that trial, we make sure that it works for you, and then we dose you appropriately at that time. And then we give you information about how to do it at home and kind of walk you through it and all the things. So we definitely get you set up before you have to go off on your own to do this. But it can be very good. Strong erections last about 30 to 60 minutes. And as it says here, customizable dosing for each patient, which is great. Some people will be on lower doses. Some people will need to be on higher doses, just depending on how effective it is for you. It can be used on demand. It doesn't have to be like a daily medication that you would take. As I said, it requires self-injection. So if you're someone who does not do well with injecting, it could, elicit some anxiety for you. There is a big risk for priapism here. So priapism can happen with any sort of ED medication, depending on how it's being taken. But with Trimex injections specifically, because again, we're putting the medication directly into the penis. And so priapism is just an erection that lasts more than 4 hours. That can be a medical emergency. We say after 2 hours to take a cold shower and Sudafed if you're able to take Sudafed, because that will then open up those channels so that the blood could release and get out of the penis. But if that doesn't happen after 4 hours and you still have an erection, we gotta drain you, unfortunately. So either in the office or in the emergency room. And then the other kind of downers of Trimex or downsides can be that it can cause some penile pain or bruising if it's not done right, scar tissue over time. So we've had where it's documented patients who have done Trimex for years and years and years. Over time, they can cause a scar tissue, which can then cause Peyronie's disease, which we'll talk about in a different slide. So different things to kind of think about when you're making treatment option decisions and things like that. Also, not ideal for people who have poor manual dexterity or even vision issues. It would not be a good thing you would probably not be a great candidate if those are some of the issues you have, just because we need it to be a little bit more, you've got to mess around with the vial and the needles and all the things. So, and then for non-responders of any of those things, as I mentioned before, there's surgery, including penile prosthesis, which we do not do, but we can definitely refer you. Peyronie's disease. So the American Urology Association definition of Peyronie's disease is an acquired penile deformity, which is characterized by the development of a plaque or buildup of fibrous tissue within the tunica albuginea, which is the lining, as you can see here, of the erectile tissue. So the capus corvinosum, which we saw earlier, is that engorges and fills with blood. But if you get plaque or fibrous tissue that forms in this area, you're going to get a bend there that happens. So this plaque can oftentimes lead to that curvature, pain, or erectile dysfunction, or all three. But mostly it's going to be a painful erection with a curvature that's noted. That's oftentimes textbook Peyronie's disease. And some men have a sort of a natural curvature that they've always had, but this is more of a distinct curvature. Oftentimes it could be a curvature towards you, depending on where the plaque or even the fibrous tissue occurs, or it can be to one side or the other. So definitely there's not just one way to see Peyronie's disease. It can also be seen as a hourglass kind of figure in the penis as well, with a little bit of a bulge mid shaft and then out, and then with a thinner frame and then out again. So different ways to see Peyronie's disease, but definitely if there's a curvature and there's pain, you might be someone experiencing this. But good thing is there's treatment options, obviously. The symptoms, as I said, mostly pain. You come in, the workup would include getting a history, doing a physical exam. We have to be able to palpate that plaque depending on where the curvature is. It's really good to get a curvature angle. So as weird as this sounds, being able to measure the angle, that's going to be very helpful for treatment options. So as you see on this other side, treatment options include vitamin E, pentoxifylline, which has limited evidence. It is an oral pill that says it's supposed to prevent the worsening of plaque buildup. But again, not so much data on it. We don't use it in practice, or at least I don't in the clinic. So nothing that I'm overly familiar with, but it's definitely part of a Peyronie's disease treatment plan. And then there's Restore X, which is a traction therapy device, which goes over at towards the base of the penis, and it helps to remodel the penile tissue. So trying to just stretch back the curvature to midline. And so if you are having Peyronie's disease, this device can be helpful. It is not insurance approved. It is like a cash pay option. I believe it's somewhere in the $500 range, but you can get it, and you have to be very consistent with Restore X. That doesn't mean use it every now and again when you want to, but the more consistent you are, the more likely you are to see very good benefits. Then we have the Xylifex injection, which is the non-surgical FDA-approved treatment for erectile dysfunction. It's basically an enzyme called collagenase that breaks down the collagen, and that's basically the main component of most of Peyronie plaque. So it is an injection that is done in the office. We have providers that are, I think we're all qualified to do it at this point. But it can cause penile bruising, swelling, which is quite common. Rare but serious side effect would be penile fracture, which can happen after the injection. But we kind of walk you through, after the injection is done, the different things that we need for you to do in order to prevent any of that kind of stuff from happening. I think it's about a 1% risk, if I remember correctly from the literature. Rare, but again, if it happens, quite serious. Downside of this is that it does require multiple visits for you to kind of get this done. And then there's like a down period and back in the office and out of the office you go. So kind of you kind of have to be patient with it. But once it's done, there's tons of literature that shows really good outcomes of this. And it does really work well with Restore X, by the way. They're two different companies, but we found anecdotally in practice that when we pair Xyliflex with the Restore X, it works really well. You have to be doing some sort of penile therapy anyways after the Xyliflex. So we said, why, pair it up with Restore X, and found that seems to be like sort of a great pair. So if that's something that you experience, we probably at some point would recommend that combination. Shockwave therapy, which we'll talk about here in a minute. And then there is surgery, different surgeries to help with removal of the plaque and things of that nature. So let's talk PRP. So PRP, or the P-SHOT, platelet-rich plasma. Platelet-rich plasma is part of this regenerative sort of ongoing wellness space that's going on. Specifically, since 1987, the regenerative properties were identified in the field of reconstructive surgery. So we use PRP for different joint injuries. We use it for vampire facials, what we call it, just more youthful skin. And now we're using it for erectile dysfunction. So this is all, stuff that's done in trials. Nothing is like FDA approved. PRP is a cash pay treatment that we do in our office. There's small studies surrounding it. Clinical trials, though, did show some promising evidence that guys were reporting stronger erections, better sexual experiences. In general, what I've seen in practice is increased penile sensitivity. I've seen increased girth, increased length. We've seen, guys able to maintain longer lasting erections. And then obviously, we do sexual health inventories and things of that nature as well, where we have not just a report, but even sort of more specific evidence that's documented that can show a change as well. When we do this in the office, the process is pretty simple. It's a procedure where we bring you in, we collect your blood, and that blood is then put and separated and spun in this special machine. And then we extract what we call liquid gold, which is the platelet-rich plasma, or even platelet-poor plasma. Sometimes some people will combine the two to get even more plasma for the specific procedure. With PRP, just in summary, it is an injection. So it's done by a provider. I specifically do them in our practice, and I've done them now for 2.5 years. Injected, you come in, we do all the things, and then I will numb the penis with lidocaine injections. And I'm not doing any blocks or anything. Some providers will do blocks, but I'll just inject the penis. We'll also try to numb the penis before the lidocaine injections with like a lidocaine cream. We kind of have the conversation about what's kind of best. Everybody's pain tolerance is different. And then we take that liquid gold and then we will inject into the penis. Now I inject into 5 different areas of the penis. So if you're looking here at the penis, there is 2 on one side of the shaft, 2 on the other side of the shaft, and then 1 into the glands or the head here of the penis. So, as far as like evidence, it is limited, but studies do suggest that it's very beneficial. And AUA study quite recently showed that it can be safe and effective, but opinions vary. I will say my opinion of it from day one to now has changed, because I didn't know how great something like this would be for my patient population. I found that it's been quite good, and oftentimes I say if I were to get 10 guys and survey them, 9 out of the 10 guys would have said that they had some sort of positive change from either PRP or shockwave therapy, or a combination of both. So not all providers will say that. You have some providers that have not had great results with this, and not everybody's going to have the same opinion on it. The evidence is very anecdotal. So, but if you do get the P shot, it can be as good up to from 6 months to a year. Some people like to do maintenance PRP injections, which are from anywhere. You just have to have it after 3 months. So you do the procedure. It's a one-time thing, but you can do it again after 3 months. You can do it after 6 months, a year, depending on how good you get benefit from it. So the goal is to boost healing, repair that penile tissue. You want to improve that nerve and blood vessel health, right, that you see here in the chart, in order to get a better, longer lasting erection. So we're trying to stimulate those vessels, regenerate better cells there for in order to hold that blood when it comes to the penis. People who will be good for it are usually people with mild to moderate ED, and especially in people who want a more natural or regenerative option. Probably not the best for someone with severe ED, someone who's had erectile dysfunction for several years. But it's always something that you can try. Again, it is an out-of-pocket cash pay treatment. So just depending on where you are in your journey, it's definitely an option. Low intensity shockwave therapy. So this are just basically shockwaves that are acoustic waves that carry energy and propagate through a medium that can be targeted and focused in a specific area. So for here, we're talking the penile tissue, right? So basically the shock waves interact with that targeted deep tissue where they can cause a little bit of a mechanical stress and a little bit of micro trauma, but then that micro trauma induces what's this cascade of different reactions that release angiogenic factors. So this is where we get neovascularization or revascularization. And as a result, we're getting longer lasting erections. We're getting increased penile sensitivity. There's been studies on this. I think probably between the two, shockwave therapy probably has a little bit more promising data out there as far as clinical trials and things of that nature. So in summary, it stimulates angiogenesis and improves penile blood flow. As you can see here, this is a before and this is an after. Results are going to vary depending on each individual. Again, how long have you had erectile dysfunction? Those type of things. As far as the shockwave therapy, different from the P-shot, you're not coming in just once. You are going to have to commit to at least 6 sessions to start. We do have 6, 9, and 12 available with different packages. This is also a cash pay option. We are providing treatment once a week for at least 6 weeks. And, we're hoping we see some improvement in some of the surveys that we do at baseline and some of the reporting of symptoms that a change in reported symptoms as well. Most people generally tolerate this well. It's, there's no downtime, so you don't have to, you can have sex right after any activity, things like that. You don't have to worry about any restrictions. Now with the P-shot, you can't have sex for after 2 days, within 2 days after the procedure. And then we do recommend that penis pump in order to keep erections going at least twice a day for 10 days. So the reason behind that is that, that plasma that we injected in there is going to be working in an erect state. And so we want for you to get an erection at least twice a day in order to make all of that very effective. So contraindications here, maybe people who have bleeding disorders or some penile skin conditions or something like that. But most people can get away with doing shockwave therapy without much restriction. Okay, so we've made it to the end, friends. About 15 minutes left on the clock. This discount code, MENS10, is basically your way to getting a discount if you want to do any of the treatment options that I have mentioned earlier today, whether that be the P-shot or shockwave therapy. We do have those options available. And when you do schedule an appointment for a consult, mention MENS10 during the visit so that we can make sure that we get you a discount if you do decide to pursue any of those treatment options.